Good afternoon. Good afternoon. Good afternoon. Good afternoon, White Plains. Happy Tuesday. It is finally sunny, but it's not going to stay sunny for long, apparently. Thank you very much for jumping in. I know this is a very quick update. Just wanted to give everyone an update on where we are. Last time we spoke was Sunday evening. Here we are 2 days later, 2 school days later, and I again have to start out with a tremendous thank you to all the faculty, staff, administrators, supports everybody in the White Plains City School District for working so hard to keep us open. It is a monumental task. It truly is. I know many folks were saying, maybe even continue to say, how are you staying open? How are you able to keep bringing children in for in-person learning? And the answer is very simply this: because our faculty, staff, and administrators are showing up. They're doing what they can to make sure that they're keeping themselves healthy. They're doing what they can to take care of their families, and they're showing up in our classrooms to take care of and support our children. And for that, we are all grateful. That said, every day is a challenge. We yesterday exceeded 200 absences, faculty, staff, and administrators. Today we were up right around that number, a little less today. We continue to monitor our absences to make sure that we're able to appropriately staff our classrooms and our facilities to ensure the safety and security of all of our kids. The primary goal, again, is to continue to offer in-person instruction to our Tigers throughout this surge to the very, very best of our ability. And I said this to you on Sunday. I might come to you at some point in time and say, I'm unable to do it in one building or another or a classroom. But we are working really, really hard to be able to maintain our facilities open and keep our kids coming. That's so important. COVID-19, the Omicron variant maybe, or any of the other variants, they're with us. They're here. We know that. It's in Westchester County. It's in White Plains. We see the case numbers going up. The doctors who I have the privilege to be able to speak with and connect with and learn from continue to tell me that they're seeing case numbers go up. That's everywhere. The question is, are we able to avoid the closures or the pivot back to remote that some school districts were unable to avoid? And that remains to be seen. We are working hard at it, though. I will tell you that. We are trying to do everything we possibly can. So, as an update to you, just a reminder. We have folks who are out, and if some of the classroom experiences are a little bit different over the next few days, please, do all you can to bear with us. I know I've been asking you to be flexible for almost 2 years now, and I do appreciate that everything. We appreciate everything that you're giving us from home as well. If we can be of assistance to you, please don't hesitate to reach out to your principals. Don't hesitate to reach out to me. Any way that we can support you, we will. Tomorrow, Wednesday, the White Plains City School District Reopening Committee will be meeting. I had shared this with you over the weekend and last week, and we will be discussing the Test to Stay program. This is the program that would help avoid quarantine and isolation for students who may have been exposed to COVID-19 while in school. Following tomorrow's meeting, we'll share the outcome with you if we are able to move into a test to stay scenario, which I suspect hopefully we will be able to. We will share the details of how to do that with you if your child becomes part of a contact trace and potential isolation quarantine. There's a lot of things happening very, very fast, as you all know, and we want to do everything we can to keep you up to date there as well. The other thing that we're working on right now is continuing to support our kiddos who are at home in quarantine and isolation. Test to Stay will do a lot to alleviate that. In the interim right now, providing that support and that contact at home is important to us as well. So we're also looking at additional ways that we may be able to bolster and support our kids who are at home in quarantine. If your child's struggling, please reach out to us as soon as you can. Let us know. We want to do everything that we possibly can to support our kiddos, especially if they're in a situation where they're quarantined or isolated at home. Look, we know that the most important thing that we can do is be open for our kids. So many of our children rely on the ability to be in school every day, and we need to be there for them. That's why we're working so hard to do this. Transportation, I know some of it sometimes has been a bit of a challenge. If you have bus drivers out, if we have folks that are covering the routes, we're doing our very best to keep that continuity and keep that stability there for transportation as well. If you experience any difficulties with transportation, please feel free to reach out to us. We'll do everything that we can to smooth that up and fix any snags that you may be experiencing. So the long and the short of it is that this update is a fairly positive one in that we're still pushing forward. We're still serving our children, we're still serving our community, and of course our faculty, staff, and administrators are working really hard to be able to do that. I will be back, or I will share with you the reopening committee meeting tomorrow, so you'll be able to view the outcome of that meeting. And then, of course, we'll communicate with you related to test to stay. There have been some questions about masking, KN95 masks. Yes, the district is ordering KN95 masks to be able to utilize when needed. Parents and guardians have asked, can I send my child with a KN95 mask? Absolutely, you can. Parents and guardians often ask questions about potential contacts outside of school. And you know, I don't, when I respond, I don't mean to be frustrating at all. What I do oftentimes, though, is direct parents to speak to either their physician or one of our nurses in the health services department, as I do not want to step in the wrong direction and give the wrong information. It's important to remember that the White Plains City School District doesn't set the rules for quarantine and isolation. That's done at the Department of Health level. All school districts are following the same sets of protocols, but also the questions are always unique. Because depending upon the exposure, depending upon you know, the number of folks who may be ill at home, the types of tests that are used, these are all different scenarios. So as always, if you have questions related to the health of your child, the best first phone call to make would be to your child's pediatrician. That also goes with whether or not it is, you know, safe, and that's a question that parents have asked, understandably, all throughout the pandemic, to send my child to school. That's a great question to ask the pediatrician as well. From what I have been told by pediatricians is, by and large, being in school is far more beneficial than not being in school. And as I had mentioned during our last reopening committee, our last live update, we would never open our facilities to our children or our faculty and staff members if we did not have data to support it being safe. The fact is, we do have data to support that being in school is safe. Doesn't mean it's free of COVID-19, just like it doesn't mean it's free of the rhinovirus. It's not free, you know, of other contagious or communicable illnesses, but we do our best to keep the spread of illness down in our facilities, whether it be COVID-19 or whether it be the common, you know, cold or flu. So we know, and again, because we've done this before, we know that our facilities are very well cleaned, very well ventilated. We know that children are doing their part, faculty and staff members are doing their part, parents and guardians are doing their part, and everybody is trying to do their very best to keep kids in school. I think the last question that we hear a lot is, when will the COVID-19 protocols be lifted? And I continue to hear questions related to that, and the answer is, I don't know. If and when I find out, I will let you know. Folks have been clamoring, understandably, for an off-ramp. You know, after this holiday surge, if you will, is there a metric by which, you know, we're going to align ourselves? I think that will come. I do think that the next 14 days are, you know, challenging days if you're in a school district setting. And we also, you know, we understand that there are lingering questions out there related to the duration of how long we will have to continue to do this. So I'll keep you updated as best as I can with all the information that I have. If you have questions or concerns, again, always reach out. I'm going to look into the chat. I don't know if there are any questions in there today. If there are and I can answer them, I'll be happy to do so. And then, of course, I'll be back with you again. Good afternoon, everybody. Happy New Year. Thanks so much for jumping in. Let me see here. Let's see. Nope, we're not closed. Thanks so much, Emmy, for asking your question. We're still open. Why is there no option for remote learning? Thank you, Victoria, for your question. Why is there no option for remote learning during quarantine? When will these kids be able to test to go back to school so they don't have to necessarily? I think I answered the test to stay piece. Well, that meeting's tomorrow, taking place tomorrow. We'll have more information then. Remote learning, we don't have remote learning. What we do have is the quarantine instructional continuity plan, where we can assist with students who are at home, direct contact with faculty, staff members here at school, and we're going to be looking to build that program out even more. So Victoria, you'll hear more about that. If you have questions, please reach out to your child's teacher. If you have needs, please reach out to your child's teacher as well. Thank you. I need closed captioning in Spanish. I'll do what I can to be able to have closed captioning in Spanish. Thank you very much. Good afternoon, everybody. I'm just looking to see if there are any new questions in here. Thanks for your question, Ms. Dunphy. Is there a way for Nurse Maggie to pre-schedule a booster session for children 11 and up? Just like vaccination, we connect with the county and the state for our vaccination clinics, and we will do the same with booster clinics. There's not an ability to sort of pre-register because once the boosters and vaccinations become available, they're just available. So we're always on the list, if that's what you're asking, to be a site for vaccination and for boosters. Thank you for your question. Questions related to quarantine requirements for teachers. I would ask you to visit the district's reopening page. The quarantine requirements for adults, fully vaccinated or unvaccinated, vaccinated and boosted, they're all different. So it depends upon what your particular scenario is. Do you know if the DOH will be adopting new CDC guidelines for a 5-day return to work instead of a 10-day? That has already been adopted by the New York State Department of Health. That is existing. It exists right now, and all members of our school community can take advantage of that, of course, if you're well. When questions are asked about the safety, what is being implemented in school and how is it being monitored? This is more serious than the common cold and the flu. Yeah, thanks very much for your question. Well, there's a lot of things happening in terms of monitoring for this illness, much more than we've ever done for any illness, at least in my lifetime, for sure. Happy to talk to you about those, all of those details if you like. You could feel free to reach out. Dr. Ricca, when a student is asymptomatic close contact from a community exposure at home, for example, and thus CDC guidelines and DOH require them to be masked for 10 days outside, how do schools handle that student at lunchtime? So anybody needs to be able to take their masks off when they eat food. And I know you know that, or if you're in another scenario when you need to take your mask off, and there are also people who just can't wear masks, and we handle that as need be with our children, and we also continue to encourage children to distance themselves and take those proper precautions, particularly and I'm talking more of the upper level students, but we work with parents and guardians too when there may be an issue. Thanks so much. I think, let me see, the question regarding swimming. If the variant lingers in the air much longer than other variant as previously stated, how is swimming safe? With the kids being masked close together in the pool. Thanks so much, Allison. So we do our best to keep everybody safe on the deck by, again, physically distancing and wearing masks, but nothing, at least nothing that I've seen thus far related to swimming and the COVID-19 virus as a concern. Thanks very much for your question. If you are concerned, particularly for your child, please feel free to reach out to the teacher, and we can assist you in any way that we're able. I've signed up for the testing program at the high school. I've not received information on how to get started. You will absolutely receive information that's going to be coming to you. Don't worry, if you're signed up, it's coming. Thanks for your question. My daughter. Oh, thanks. Thank you very much. Glad to hear that teachers have been accessible. Do middle school students and high school students need to pick up their tests? No, I think you're referring to. I'm not quite sure what you're referring to, Lucia. I think you might be referring to the saliva tests that you're going to be taking if you signed up. Those tests will be provided to you. Hi, Daniela. What are the chances we will go remote? Unknown. I will tell you that we are doing everything we can to avoid that scenario. If we change that question a little bit and say, what are the chances that the entire district goes remote all at once? I would say very, very small, almost minimal, if anything. As I mentioned a couple of weeks ago, our goal is to remain open for in-person learning. Really, two reasons that we wouldn't, and one would be the inability to effectively staff our facilities safely, and or that there was a mandate that districts go remote. Let me see. One of my family got infected traveling. Even the grandma and grandpa got it. They're okay. Oh, okay. Great. I'm glad that everybody got okay. Everybody got well. That's excellent. Is a great question. Thanks, Lisa. Is there a threshold for positive cases? It's been a great question. People ask this question. What's the number? What's the percentage, Joe, for moving to remote? And there is no percentage. It's because depending upon the number of folks in the functions that they work in, it really depends on if all of those folks were impacted. So there's not a set percentage, like, you hit 30%, we have to move to remote. It's really whether or not we can cover those classes, cover those positions with other team members who are unaffected. Great question. Thanks so much, Jenny, for your question. Will at-home tests be distributed to families? The White Plains City School District at this time is not sending out tests into the community. What we are going to be proposing, and this will be tomorrow at the reopening committee, is that we utilize those tests that were sent from the state to keep children out of quarantine and isolation. So to use that for the Test to Stay program. Remember, it's not an unlimited supply of tests. We received a test for every child in the district, and that's how we plan to use those tests. We are also offering testing to everybody in children and employees in the White Plains City School District through our third-party partner, and folks can take advantage of that right now. But again, we're not just sending out the tests into the community. Let me see here. How is attendance being handled when students are pending COVID test results? My middle schooler is being marked absent in the schools. So, right, if your child's out pending test results, the child's absent. We can, I wouldn't worry so much, and I know, it's easy to say this, right, about absences, during the pandemic. Everybody is absent at some point in time, and being absent right now while you're awaiting those test results, let me say this: thank you. The last thing we want folks to do is, if they're not feeling well, or if they're potentially exposed and they're awaiting tests, is to be in a place where they could potentially be spreading and then continuing the problem. So it's thank you so much for waiting until you get the results coming in. And again, with regard to absences, everybody is kind of contending with that right now. So try not too much to stress about that. Students, thanks, Claudia. If a student is fully vaccinated, exposed to another student at school, are they exempt from quarantine? Depends. It depends on the nature of the potential exposure, but at the very least, if and when we were in Test to Stay, they would be able to participate in Test to Stay and would be able to avoid quarantine and isolation. Thanks, Jacob. We worry that people opposed to vaccines and masks will not take the Test to Stay seriously, might cheat if their kids test positive. Yeah, thanks so much. There is a lot of concern about what if somebody does this or what if somebody does that. I understand that. Believe me, I'm with you. I have those same thoughts and same concerns. What I do recognize, though, is there's little that we can do about that, right? We can't control necessarily what people are going to do. What we can do is, speak to their better angels and ask them to assist us so that the decision of one doesn't have a negative impact on many. And we'll continue to do that. Thanks, Jacob, for bringing it up. I know it's something that we're all thinking about. I will say this: in White Plains, to the date, we have had a tremendous partnership with parents and guardians and children to do the right thing to keep us moving in the right direction. Isn't the new 5-day CDC rule adopted for essential workers in New York and not for everyone? Thanks for your question, Heidi. I think I'm not sure what you're referring to, but if you look back to the New York State Department of Health guidance from, I think it's December 24th, there is an appendices there, and I think it's item 8 or 9. We're in it. Teachers are in it. We're part of it. Okay. Hi, Lucia. Can school lunch menus be updated? Yes, school lunch menus are going to be updated. Thank you. Will the Zoom app be reinstalled? Hi, Lauren. The Zoom is available for our kids if they need it. They'll be able to access it. Thank you very much. Should students have registered to receive a saliva test yesterday? Thanks, Elizabeth. It's coming, so those tests are going to be rolling out, and they'll be coming to you. Everybody won't get them all at the same time, so I just ask that you just be aware, and we'll contact you and let you know when that's taking place. Hi, Jacob. Is New York State considering adding COVID to the lists of not that I am aware. I am not aware at all of the COVID vaccine as being discussed as a required vaccine. It's important to remember that this vaccine is in emergency use authorization. And I don't think that mandating an emergency use vaccine is something that is being talked about right now at the State Department of Health level. Hi Steve, can we get KN95 masks? I think you're referring to, since they say the cloth mask. I saw that, Steve. Thanks for bringing it up. I saw that that news clip too of the doctor talking about cloth masks, and she saying that they're basically useless. And I know how damaging that was, to so many parents and guardians, all of us, right? Depending upon where you read, depending upon what you think. Folks have views on masks, and I totally respect that. One thing I do know is that if the virus is transmitted in spit particles or in particles that are floating in the air, and you put a barrier in front of it, and even if that barrier reduces some of potential virus particles that somebody else could bring in, it probably has some positive effect, right? KN95 masks have smaller particles are still kept out, so likely they would be more effective. The district will have the ability for parents and guardians who request to provide KN95 masks to students. Remember, it's a different type of mask, though. You can't throw that in the washing machine like you can with your cloth masks. Parents and guardians are also welcome to purchase KN95 masks for their children as well. And we'll keep that conversation going, but at this time, masking still remains required in all the facilities and on all transportation. Hi, Sylvia. Thanks so much. Thanks, John. Okay, I think I may have gotten a, here's one. Will schools consider going back to temperature checks upon entry? We have temperature check kiosks at all of our entries. They're still available. We still have walk-through temperature scanning. Right now, we're really focusing more on parents and guardians. We've been doing this for a while now, and we all kind of know what the situation is, and monitoring health symptoms at home is so important. So, prior to your child, you get a sense, right? You give your child a kiss goodbye, or feel their head, and if there's a concern or if you're seeing symptoms, do make sure that your little one is well before sending them to school. Thanks. And it's still taking place in many of our elementary schools as well. Temperature taking. Hi, Sarah. Is it helpful for school nurses to have students' vaccination records? If so, perhaps an announcement could be made. So we have vaccination records thanks, Sarah, for all of the children for the required vaccines. What we have been doing is we've been saying to parents and guardians, if you wish us to know the status of your child's COVID-19 vaccine, whether or not your child has been vaccinated, please let us know. That will absolutely assist in contact tracing and potential quarantine and isolation, because it puts the child in a different category in a different period of time. That is always useful information. So if your child has been vaccinated and you're not sure if your school nurse knows, please consider, if you'd like to, letting your school nurse know as well. Thanks again, Sarah. Great point. Hi, Jennifer. Many parents do not have access to the internet at home and have expressed that they need to go to the public library to access online work. Jennifer, I'm so glad you asked that question. So we have the ability to assist, and anybody who needs help with internet access need only reach out to their school. We will assist in any way we can to get access to our families who don't have access at home. I also just sent out, thanks to Mr. Velez, we just sent out a different type of internet accessibility program through the federal government, which provides more affordable internet access. You can see that information right on the district's website. We put it in the new announcements that just came out as well. Great question. Thank you very much. Hi, Sylvia. I've not been able to find KN95. or K95 masks. Does the district have the ability and connections to purchase N95s and sell them to students? So we're purchasing as many masks as we can. We're not going to sell them to our kiddos. If our children need them, we'll get them to them. Some parents and guardians don't want their children wearing that type of a mask. They'd rather have their children wearing cloth masks. So, again, if that's something you're interested in, please reach out to your child's school nurse, and we'll do what we can to get you one. And Ron Velez, thanks so much, sir. Wi-Fi at home request form is right there in the comment section. So anybody, please feel free to share that opportunity with folks who may need access to internet. And if that's still cost prohibitive, again, please reach out to us so that we can assist. I think I answered all of the questions, at least in my feed that I can see. Okay. So again, thank you so much to everybody who's tuned in, the 305 of you who popped in right now, and anybody who's watching later. Just a reminder, if you're watching this video later, I won't be able to answer the questions, so please reach out to us directly or your child's principal. Again, huge thank you to everybody for your flexibility, your continued patience, and really your perseverance here. It's really hard. It's been a very hard time, and look, we all kind of knew that the holidays were going to bring this spike in cases. Maybe we didn't know that it was going to be so pervasive, but at the same time, it doesn't make it any easier. I also know that there are people out there who are struggling right now with this virus, and they're very ill, or loved ones are very ill. Our hearts, go out to all the members of our community right now who are struggling with this. For some of us, it's a runny nose. For others, it's a devastating illness. And I think, what we've tried to do is understand everybody's point of view and what everybody's experiencing. I thank you for your patience and your grace. If we can be helpful, please feel free to reach out. Reopening committee video will be shared tomorrow. I'll be back to give you an update later on in the week. We are looking at some winter weather potentially into tomorrow morning. A little bit of ice in the morning is being predicted, and we're also looking at potentially a little bit of snow toward the end of the week. My next meeting is to discuss weather. And of course, if we have to make any adjustments to our schedule because of good old winter weather, we'll let you know that as soon as we can as well. Thanks, everybody. Have a great afternoon. Stay strong and stay WP proud. Talk to you soon.